ExCPT Practice Test Pharmacy Technicians Mock Exam and Study Guide, 25 Most Common Questions. Question 1. Which of the following tasks can be performed only by a licensed pharmacist? Counting out tablets for a prescription, accepting a new verbal prescription from a doctor's office, entering patient insurance information into the computer, applying a label to a medication vial. Pharmacy technicians cannot take new verbal prescriptions. This requires the clinical judgment of a pharmacist. Question 2. A prescription for amoxicillin is written as 1 cap per tid x 10 days. How many capsules should be dispensed? 10, 20, 30, 40. Tid means 3 times a day. 1 cap asterisk 3 times / day asterisk 10 days equals 30 capsules. Question 3. What is the correct way to store a medication that requires room temperature? Between 2 and 8 degrees Celsius. Between 20 and 25 degrees Celsius. Below 0 degrees Celsius. Between 35 and 40 degrees Celsius. Standard room temperature is defined as 68 to 77 degrees Fahrenheit or 20 to 25 degrees Celsius. Question 4. The abbreviation SL on a prescription refers to which route of administration? Subcutaneous, sublingual, slow release, slightly diluted. SL stands for sublingual, meaning under the tongue. Question 5. A patient is prescribed 15 mg per kilogram of an antibiotic twice daily. If the child weighs 66 pounds, what is the total daily dose? 450 mg, 900 mg, 1,350 mg, 1,800 mg. 66 pounds / 2.2 equals 30 kilograms. 30 kilograms asterisk 15 mg per kilogram equals 450 mg per dose. Since it is twice daily, the total daily dose is 900 mg. Question 6. Which of the following is an example of an exempt narcotic in some states? Oxycodone, guaifenesin with codeine syrup, alprazolam, fentanyl patches. Schedule V cough preparations with limited codeine are often referred to as exempt narcotics because they can sometimes be sold without a prescription, depending on state law. Question 7. What is the maximum amount of pseudoephedrine that can be sold to an individual in a single day? 3.6 grams, 7.5 grams, 9 grams, 12 grams. Under the Combat Methamphetamine Epidemic Act, the daily limit is 3.6 grams. Question 8. Which of the following is a type of automated dispensing system used on nursing units? Baker Cell, Pyxis MedStation, Kirby Lester, Laminar Flow Hood. Pyxis and Omnicell are common automated cabinets found in hospital wards. Question 9. Which filter is required in a laminar flow hood to provide a sterile environment? Carbon filter, HEPA filter, UV filter, fiberglass filter. High-efficiency particulate air, HEPA, filters remove 99.97% of particles 0.3 microns or larger. Question 10. What should a technician do if they notice a potential therapeutic duplication in a patient's profile? Ignore it if the doctors are different. Delete the older prescription. Alert the pharmacist immediately. Ask the patient which one they like better. Technicians must identify potential drug-drug interactions or duplications and bring them to the pharmacist's attention. Question 11. The sinoatrial (SA) node of the heart is located in the left ventricle, right atrium, left atrium. The SA node, the heart's natural pacemaker, is in the upper wall of the right atrium. Question 12. The Orange Book published by the FDA is used to check for drug prices, therapeutic equivalents of generic drugs, drug side effects, manufacturer contact info. The Orange Book lists approved drug products with therapeutic equivalence evaluations. Question 13. Which part of a Medicare plan covers prescription drugs? Part A, Part B, Part C, Part D. Medicare Part D is the optional prescription drug coverage program. Question 14. A black box warning on a medication package indicates the drug is expired. The drug is a Schedule II narcotic. The drug has serious or life-threatening risks. The drug is for veterinary use only. A black box warning is the FDA's most serious warning for drugs with significant safety concerns. Question 15. How often should a laminar flow hood be professionally certified? Every month, every 6 months, once a year, every 2 years. Laminar hoods must be certified at least every 6 months to ensure proper airflow and sterility. Question 16. Which of the following is a high alert medication as defined by ISMP? Amoxicillin, insulin, hydrochlorothiazide, lisinopril. Insulin is a high alert medication because it carries a significant risk of causing serious injury if used incorrectly. Question 17. The suffix olol usually indicates which class of medication? ACE inhibitors, beta blockers, calcium channel blockers, statins. Beta blockers, like propranolol, metoprolol, typically end in olol. Question 18. A technician is preparing a chemotherapy drug. Which type of hood must be used? Horizontal laminar flow hood, vertical laminar flow hood, biological safety cabinet, standard kitchen hood. No hood is required. Hazardous drugs like chemo require a vertical hood to protect the operator from exposure. Question 19. The HIPAA Act primarily deals with drug pricing, patient privacy and data security, medication errors, generic drug approval. Health Insurance Portability and Accountability Act, HIPAA, sets standards for protecting sensitive patient health information. Question 20. Which document contains instructions for the safe handling of hazardous chemicals in the pharmacy? Red Book, Safety Data Sheet, SDS, Package Insert, Formulary. SDS, formerly MSDS, provide detailed safety and emergency handling information for chemicals.